Good morning, Chairperson, distinguished delegates, friends. At the outset, I would like to thank the organizing committee of Fertigyan, especially Dr. Jyoti Budi, for having me here. So when Dr. Jyoti first told me about this topic, I was like, Dr. Jyoti, why do you have to punish me? This is such a dry topic. What am I even going to speak about this? And I'm not even a technical person. A technical person should probably be handling this topic. And she said that, Dr. Rajeev, trust me, we'll be having a lot of our fellow gynecologists at the conference. And in my opinion, your lecture will be the one from where there'll be a maximum take home for all the gynecologists compared to all the other lectures. And I'm saying that with Roy Homburg, sir, Jatin Shah, sir, all of us sitting here, but that's the vision she had. And I was wondering, why would she say that? And I started reading a little bit. And I think in the very first slide itself, I'm going to be able to show to you why she said what she said. So over 27 million couples are facing infertility. Only 1 in 10 gynecologists are currently practicing IUI or IVF. The India's ART market, we know, is booming. We know that it is one of the most growing segments in healthcare and will continue to grow at a very good rate over the next couple of years. We know that the fertility rate in India is only decreasing. I don't know if that's a good thing or a bad thing, but it is definitely decreasing. 70% of infertility cases can be managed without IVF. And thus the opportunity for all gynecologists to come forward together and practice more of at least basic infertility. So I can't help but bring out a very corny analogy here at this point. Our Prime Minister, PM Modi, did say Har Ghar Tiranga around the 15th of August. Probably that's the slogan that Dr. Jyoti Budi was wanting to bring forward, that through this lecture and through this conference, she wants to have more and more gynecologists, if possible, every single gynecologist at least practicing basic infertility. We gynecologists are very unfortunate in the sense that we start off as basic gynecologists and kind of restrict ourselves to doing the DCs and DNEs and the pregnancy management. We leave the urogynecology to the urologists, the aesthetic gynecology to the dermatologists. Some of our hysterectomies are also done by general surgeons. So our field is kind of divided and taken over by so many other fields. Basic infertility is something that every single gynecologist should practice at least till the level of IUI, and that's what I think Dr. Jyoti Budi, Fertigyan, and I'm trying to bring forward in this lecture. So blueprint to baby steps could be divided into various aspects of course, we need to have a blueprint, you need to select a place, you need to have the law, the licensing, everything has to be in place. Of course, beyond that, you have to build the infrastructure, have to know what to build, where to build, what kind of staffs to employ, and what systems to put into place. Of course, beyond that, as gynecologists, we were never taught two very important things: commerce, as to how to manage money, and two, how to market ourselves. Fortunately or unfortunately, that's something we're having to learn once we've finished our post-graduation, especially post-COVID with the bursting of social media, and I'll be talking about that a little later. But that's something also that we need to work upon. And of course, we need to, as doctors, strike a balance between what we do medically and what we do in terms of commercially and, of course, socially. When in 2021 the ART Act came in, the first thought we all had was, this is going to be such a nightmare for all of us, especially non-medical people creating the ART laws. But in the last 4 or 5 years that we've seen, it's not been that bad. Probably the IVF and fertility segment was very unregulated. We did require some sort of a law coming in and some sort of an umbrella on top where everyone kind of falls into place. Of course, there have been problems with the ART law, which to some extent are being identified and being corrected by all the PILs being filed in Supreme Court and the district courts and the high courts across the country. So you need to have a mandatory registration before starting operations. The validity is for 5 years, which is renewable. Fees is 50,000 for level 1, 2 lakhs for level 2. And of course, you have to apply to your state authorities for the same. Some of the key definitions: ART clinic would be someone offering IUI, IVF, and ICSI. ART bank would be handling the sperm and oocyte donor. Level 1 clinic can function up to IUI only. An ART practitioner would be someone who is trained in the art of ART. What can a level 1 clinic do? Of course, ovulation, induction, and follicular monitoring, intrauterine insemination, semen collection, analysis, processing, basic hormone and infection testing, preconception counseling, and subfertility counseling. Space-wise, you don't require much of a space. I mean, I mentioned here 800 to 1,000 square feet if you probably have a standalone clinic, but it's something so easy that you can, wherever you're consulting, you probably are consulting in a diagnostic center, in a hospital, you could probably integrate your practices with that particular establishment as well, because you only need few equipment separate to your practice. Majority of it, whether it's a reception, whether it's a waiting area, whether it's an ultrasound, you can actually find in the place where you're practicing at the present moment. Of course, staff-wise, you require a registered gynecologist, trained nurse, counselor, lab technician, the basic parameters being required. What a level 1 clinic cannot do. You cannot do a controlled ovarian stimulation for IVF. So if you are a practicing gynecologist, you're wanting to refer a patient to another IVF center, but you feel that why not do the controlled ovarian stimulation and send the patient for an egg collection to another center. Legally, you cannot do that because you're not having a level 2 center. Of course, all the other things of an IVF, the oocyte retrieval, embryo transfer, so on and so forth, is not possible in a level 1. Scope of a level 2, the level 1 and everything else beyond that going up to IVF is what a level 2 clinic can do. I've mentioned here very basic parameters for staffing, but of course there is far much more required beyond that, especially in a bigger center. I've mentioned here a setup of 2,000 square feet, but I think in this entire country, only the people from Mumbai can probably manage an entire IVF center in 2,000 square feet. Everyone else is going to require more of a space. 4,000 to 5,000 square feet would probably be an average amount of space which would be required to run an IVF center. Of course, with the coming of the ART bill, there are various legal aspects which are attached to it. They were also attached to us as a gynecologist. It's just that we never were so concerned about it, but now with the coming of the ART Act, we are far more concerned because they are now coming for inspections, which, the general bodies were never walking into a gynecologist's clinic and asking for their papers and how are they practicing and what are they practicing. But at least now with the formation of the ART law and the ART clinics, there are these officials who are coming into your clinic now, asking for your papers, your documentations, and wanting to see how exactly you're carrying on your fertility practice. When the ICMR guidelines were being designed, we were kind of having a mixed reaction, good, bad. There were debates happening all around. It's only when the ART Act came in that we realized that the ICMR guidelines were so good. The good part of the ICMR guidelines were that they were being formulated by actual fertility specialists, the topmost and the best minds of the country. Unfortunately, the ART Act has been formulated by bureaucrats who have absolutely no idea of how the IVF industry works. So somewhere one has to have an amalgamation of the two, because the ART Act tells you what you must do. The ICMR guideline tells you how you could probably do it well. So starting from the blueprint, of course, you have to have the right space and the layout, ground floor access, independent entry, restricted lab access. These are some of the basic things, but if you do not look into this, sometimes you can actually get into a lot of trouble. I do know of people who have an IVF center in a so-called residential commercial complex where the entry is actually same, and they face so much of trouble from the owners of the flats in the other parts of the building who kind of keep objecting to the patients who keep coming all the time. And not only that, the patients also don't feel comfortable walking into a residential complex with a common entry and then moving into a fertility clinic. So sometimes very small little things make a big difference. Air quality and infection control, whether it is a level 1 clinic or it is a level 2 clinic, your vision should always be that I'm going to provide the best. You're not going to always think that I'm going to be only doing a level 1 clinic, so I really shouldn't be so concerned about hygiene and how the lab is to be maintained. That's only for the IVF people. If you're going to think big, you're going to become big. If you're going to think small, you will always remain small. So from the very beginning, that thought process has to be there. In a level 2 as well, you could work with something very basic. You could even put up an air conditioner in your embryology lab. But at the same time, the basic thing that you need to put up is air filtration plants, HEPA filters, where the air exchange is happening multiple times during the day. You will realize that there is a significant difference in the kind of quality of work, the quality of success, the quality of care that you're able to provide to your patients. And that thought process must be there from the very beginning to the end. Infrastructure-wise, the equipment-wise, of course, for a level 1, you only require a basic laminar hood. That, again, as I said, for every small little thing, you need to step back and say, how can I make this better? You've seen a laminar flow which is a 2 feet by 2 feet. It's going to cost you lesser. It is probably going to cost you 50,000 rupees. But when you start working and you have that same laminar hood being used both for semen analysis and semen preparations, and you have 4 IUIs being done at one point in time, you realize you require a bigger space. You'll realize that in a smaller space, the chances of having errors is going to be higher. So at a micro level, you must invest in a bigger way. Of course, level 2 requires a far greater work. I've just mentioned some of the things here, but the list keeps going on and on and on. Of course, just to mention that I did mention to Dr. Budi that in one lecture, I'm not going to be able to bring forward every technical aspect of the lecture, and I'm sure there'll be a whole lot of questions, especially in terms of legalities, in terms of how to get the licenses going. And I may not be very good with the local laws and licenses. So Dr. Budi very kindly consented that the entire team of 49 would be there at the back. And any questions that you have, any help that you require in setting up your practice or your clinics could be taken care by the adept team of 49. So these are more or less the approval checklists, the registrations that you would require. You would, of course, require a basic clinical establishment. You have to have a trade license. You have to have a fire NOC. You have to have a biomedical waste, a PCP-NDT, and, of course, an ART registration. Coming to the PCP-NDT again, at a basic level 1, you don't need to really own an ultrasound machine. You can always refer it to the friendly neighborhood radiologist or a diagnostic center where the ultrasounds are to be done. But again, the quality of work that you do when you do your own ultrasounds is going to greatly change the way you look after your patient. And that radiologist giving 2 seconds to that ultrasound can never do justice to your knowledge and your expertise. So an ultrasound machine doesn't really cost very much. You should make the effort of buying one machine for yourself, even if it's a small machine. Understand that our practice somewhere is also like a business. And if you're going to invest into it, you will 100% reap benefits out of it. Documentation, compliance, of course, there are a whole lot of, you should always, even at a small level, have SOPs for your clinic, because then your entire team, all the staff speak the same language. And that becomes very comfortable even for the patient when they walk in. And if they were to ask the same question to 5 different people in your clinic, they would get the same answer for everyone if you're working through SOPs. And of course, needless to say, the chances of error happening in your clinic is going to be much lesser if you're working with SOPs. Standard things of doing an equipment calibration, maintaining logs, consent forms, and of course, you should try and maintain digital records. We are now having the courts as well coming in and saying that the doctors need to write legibly, and if they're going to use only their handwriting, they must actually write in capital letters unless you're using digital prescriptions. Budget and timelines, a level 1 center really doesn't cost very much. If you buy even the best of laminar flows, it's going to cost you, what, 1.5 lakh rupees. If you buy a good ultrasound equipment, probably 25 to 30 lakh rupees, you require a centrifuge. That's all about that you require for a level 1 center. The rest of it, as I said, you can even integrate with a diagnostic center or a hospital wherever you might be practicing. A level 2, of course, requires far much more money. The equipment itself is going to cost you a lot of money. The infrastructure will cost you a lot of money. And I will be in a short while talking to you as to when you should level up from a level 1 to a level 2 center. I've already spoken about the staffing and the vendor. Vendors for each of your products, whether it is a big machine or it is your cannulas and whatever else, should be sourced from very reliable people. Ask your colleagues in the industry as to what brands they are using. Especially for your equipment, try and always get people where local servicing is available. You don't want your equipment packing up and someone coming in 4 days later from another city to actually repair that equipment of yours. When do you level up from level 1 to level 2? Of course, it has to be dependent on your confidence as well. It's always the chicken and the egg story. Are you going to have enough patients for IVF and then level up for IVF? Or are you going to open an IVF center, of course, with the required training? And then with the practice, with marketing, with your knowledge, with expertise, hope that more and more patients would be coming in to see you for IVF. So that's a question which will always be debated. But you should definitely have a decent number of IUI practice before you probably level up for IVF. I've mentioned a figure of 40. But that, of course, can vary also depending on your own individual general gynec practice. Now, if you have a team of marketing people in your clinic and you're talking to them every month and saying, why are patients dropping out? I had 100 patients coming in this month and only 30 seem to have converted for IVF or IUI. And the standard answer everyone will give you in your team is that cost is a very, very big issue. Or even if you had a failure, maybe a 1-time or a 2-time, and the standard answer would be that cost is an issue. Of course, in a country like India, cost is an issue. But in Sweden and in Israel, they did a study where, because in Sweden and in Israel, IVF is completely free. You can do it as many times as you want, and there is no payment at all. And they still had people dropping out. And when they went back and tried to analyze why things were going wrong, they found that cost is not always the biggest issue why patients drop out of treatment, not only from your clinic, probably moving to another clinic and probably dropping out from there, and what we call as doctor shopping. So 90% of the dropouts happen due to anxiety. Cost, poor communication is one of the very important factors. So time has to be allocated to these patients. Transparency is very, very important, especially in our field. If you're coming in for a uterus removal, I know that if I'm doing a decent job, I'm going to do it well. You will come in maybe 5 days before the surgery. I will do the surgery and 100% you will be all right thereafter. But for fertility, where failures are more than successes, it's very, very important that counseling happens and transparency is taken care of. Technology, of course, impresses, but empathy will help you retain your patients. As I said, counseling before, during and after, especially in a field like infertility, where every single patient is going to come in with a huge amount of baggage. So some of the colleagues across the country would have had litigations because you froze 4 embryos. When you thawed, 1 embryo degenerated, which can happen even in the best of IVF centers, but yet that center got sued because the patient said, I did not know that something like this could happen, that my embryos could degenerate. We all know that even if we do not kind of advocate 100% pregnancy rates, we would have said maybe 20%, 30% or 40%. Yet there are these ethical centers across the country also who've been sued because the patient said, I was promised a pregnancy, the pregnancy did not happen. So somewhere there is a breakdown in our communication to these patients as to what they should be expecting from the entire treatment. Consent, of course, is a process, not a form. One of my colleagues in Kolkata got sued because they used donor eggs for a particular patient and something went wrong and the patient turned around later and said, my consent was never taken. So if you've ever taken a credit card or opened a bank account, you know that once you signed on that piece of paper, however illegibly,
however bad and however much of a hurry, you cannot go back to court later on and say that I did not know what I was doing. Medical profession is probably the only profession where the patient can always get back and say, but I was never told in my language, I never understood. I was just told to sign on a particular place, and I signed and I did not know the implication of the same. So merely signing on that particular form is not going to be good enough. You have to have a two-way communication. The patient must understand what you're trying to put across. Private counseling spaces, the clinic should look nice. Gone are those days where we would have small little, dingy little places where we doctors would consult out of, and because of our expertise, patients would come to us. You have to understand that healthcare industry is also now a service industry. Patients want that kind of, as if they're walking into a five-star hotel. They do expect the best of treatment from you, but they also expect the roundabout services. And it starts from your reception. Your receptionist is your ambassador. If the patient has a poor quality experience at your reception, they will continue to have a bad experience throughout the entire clinic. As is written here, patients remember how you made them feel, not just what you told them. Of course, you have to have a quality control when we are talking of a level 1 clinic. How do you assess your semen preparation? And I keep telling people when we train about IUI, when you're doing your insemination, just keep a small amount of semen sample in that tube of yours and put it back into the incubator. Look at it 24 hours later for a sperm survival. You know that if the sperms are surviving, if all your sperms are dying all the time, then you know there's something wrong with your semen preparation methods or probably your incubation methods. There's something somewhere going wrong. So there are simple little things. If you changed the IUI catheters, maybe you could look at the sperm survival in the IUI catheters before bringing in a fresh batch of catheters and having failures after failures into your IUI program. So whether it's an IUI or whether it's an IVF, quality control is a must. Of course, now with the ART, we have to be giving our data to the local bodies all the time. So and that's something that you should start practicing. I've already spoken about this. Coming to advertising and social media, I think there are some of us who are very actively on social media. There are some people who probably look down upon the social media, but I feel that as doctors, especially in a widely populated country like India, there has to be an edge, and that edge probably comes from social media. Also, as doctors, there has to be some way to ethically reach out to patients and let them know what is right, what is wrong, because if I don't go out and tell a patient that a PCOS is non-curable, that endometriosis can never actually go away, there are at least 100 other programs which are running saying, cure your PCOS in 2 months. Come to me and your endometriosis will go away forever. So if you don't do right, there is always someone else who's wanting to do wrong. Common legal pitfalls, of course, there are hundreds, but just to mention a few, starting IUI without an ART registration. There are doctors who are practicing in their clinics, probably asking for donor semen samples to come from a semen bank and just inseminating, thinking that, it's just one simple insemination. We don't require a setup. I do understand most of us will probably get away, but sometimes the law of the land will come heavy on you. Building reputation and networks. Collaborating with the local OBGYNs for referrals. Of course, share your success rates transparently. Do not promise those 100% and 90% success rates as it goes around the country. Train your team in empathy and communication, especially as a fertility specialist. And of course, participate in CME in public education programs. There should be a continuous education program for you yourself, so you should be part of these bodies of ISAR, IFS or ICMR training programs. Benchmark your results. If you're not honest to others, at least be honest to yourself. Look at your own success rates and benchmark them against the national levels. Digitize the records. The 5 pillars of a responsible fertility clinic would be, of course, to always maintain patients' rights, to maintain compliance and safety. Counseling and communication channels must always be open. Your lab whether it's an IUI lab or an IVF lab, must always be top grade, and your ethics must stand above everything else. You don't really need a lot of money or a big space to make a difference. You need clarity, compliance, and conscience. A small ethical level 1 clinic can transform fertility access in tier 2 and tier 3 cities. And if you, I'm sorry for putting it this way, but if you understand that if you do not level up to a level 1 clinic at this point in time, that patient which was walking into a regular gynecs clinic all these years will now start moving in towards a fertility clinic. And unfortunately, what is happening because of that is when they walk into a fertility clinic, there is a push of IVF all the time. So a patient which could have done very well, and as we saw, 70% of patients can conceive without IVF. Unfortunately, that patient after a month or 2 months or 3 months is unnecessarily being pushed into IVF because all of us are not practicing level 1 fertility clinics. How I learned fertility treatment, of course, at that time, there were none of these CMEs, there were none of these fellowships. So there is no shortcut to becoming a good fertility specialist. Read relentlessly. I think that is something that everyone has to do all the time. Every single conceivable book on fertility is something that you should have read. A strong theoretical base will go a very long way, and you'll understand that you're far more confident in dealing with your patients, especially if say as an IVF specialist you have a total fertilization failure, your D3 embryos don't become blastocysts, or something goes wrong in the lab. You will have the confidence to talk to your patients staring right into the eye if your theoretical knowledge is very good. Write down every doubt and question and ask it in the next conference. That's what I used to do. I would read, and of course I would have 1,000 doubts, and I would keep going around and asking all my seniors at that point in time those various questions. Unfortunately, a lot of us who stand on these podiums don't always also practice what we preach, thereby, which is why you have to probably go around asking more number of people and then kind of averaging the answers to see what suits best to your practice. And visit other centers. It gives you so much of information when you see other colleagues, how they are practicing, what they are doing, and even at our level, and my seniors sitting here as well, there is always an exchange of ideas, and whenever you go to someone else, there is always something new that you'll learn, no matter how young the other person is. And above all, read and update yourself daily. It's the only way to keep evolving. Experience without study leads to arrogance. Study without experience leads to confusion. True mastery lies in balancing both. Thank you so much for a patient hearing.